there guys, welcome to the channel. This is Nick from In Control Physio, channel where we look at rehab treatment and break it down so anybody can easily pick it up. Today we're going through tennis elbow rehab. So if you've got elbow pain, I think you're really going to want to stick around for this one. So tennis elbow, really famous condition, everybody's heard of it. I'd be shocked if you hadn't, right? Unlike some famous conditions where people think they're more common than they actually are, tennis elbow actually is the most common reason for elbow pain. So what we're going to do in this video, first of all, we're going to go through explain a bit of what tennis elbow actually is so we can understand it. Then we're going to dive onto some rehab and look at how we can actually influence it and help us recover from it. So first of all, let's get a basic understanding of the condition, because without that, how are we going to understand it well enough to rehab it and treat it? So it's more officially known as lateral epicondylitis, which, yes, it's a massive mouthful. No one ever calls it that, so let's just call it tennis elbow like everybody else does. It's classed as a tendinopathy, which is a overuse or overload injury of a tendon. In this case, our tendon is here. Tendon is just where a muscle attaches to a bone. So the muscle in question is the extensor muscle group, which goes from the wrist down to the tendon that attaches at the elbow there. In the case of tennis elbow, it's always the one on this outside edge. If we're presenting with pain anywhere else around the elbow, that's not tennis elbow. If someone come to me in clinic and said, oh, I've got tennis elbow, but their pain was presenting in another part of the elbow, I'm going to want them to look into that further and get a different diagnosis. As you've probably guessed, no, it doesn't most commonly occur from playing tennis. That would have to be a lot of tennis played to see as much tennis elbow as we do. No, it more commonly occurs in people's jobs, their careers. So, repetitive one-arm movements. Think mechanic, think electrician, think gardener, and yes, desk-based jobs as well. So now we know this tendon is painful because it's been overloaded or overused. It isn't handling the load it's been placed under. So how are we going to change that? Well, let's go over some key treatment that I would go through with a client to get rid of this problem. So the first crucial step in treatment would be activity or load management. Removing that overuse or overload that's been identified as causing the problem in the first place and bringing it back down into a normal amount of load that the tendon actually can handle. I'll give you an example of this. So let's say you've been decorating your house. You've done a 4-hour decorating session 4 days in a row. If say next week we took that down to a 3-hour session, 3 days, that might just be enough to settle off the pain, enough to kind of reset the tendon so it can readapt again. Yes, in some situations people do want total rest, and that's fine. I usually wouldn't use that, and I'll give you the reasons why. First one, it's not really needed, and it's much more of a disruption to people's lives. We want to disrupt people's lives as little as possible. If you only need to reduce a little bit rather than completely stop to get the problem sorted, then it's much easier to do that, much easier to get by than completely removing something somebody loves or something someone really needs to do. The second thing, we want to limit the amount of deconditioning that happens to the tendon. Yes, it might need to rest and remove that overload to be able to recover, but if we stop it from doing anything, its ability to handle things is just going to drop and drop way further than we actually need it to, and then you likely need to start again from a lower level than you otherwise would need to. People understand this in terms of strength training, but it does apply here in the tendon as well. Say in the gym, you're lifting something regularly, you get better at it. If you stop lifting it regularly, you get worse at it. That's what applies here. So reduction and rest can, in the more minor cases, be enough to sort the problem on its own. But what do we do when it's not enough? Well, that's where exercise rehab comes in. You might be the sort of person who's sitting there thinking, oh, exercise? Why am I relying on exercise? Don't I need something a bit bigger, a bit more hands-on maybe, massage, something like that? In this case, in a lot of cases, that's not what you need. Massage might have a nice short-term benefit, short-term relief, but it's not going to sort the issue, the root cause of the problem. Exercise treatment is what I use to successfully rehab my patients, and it's what all of the experts I would consider in my career that I've come across are using as well. And this is how exercise works. It progressively builds back up the amount the tendon can handle, its capacity to handle load, essentially. Let's say this is your level of capacity the tendon would normally handle. Everything up to that point it's handling. It's down here at the moment because you're struggling with tennis elbow, so you're only handling up to there. We're going to work within that. We're going to push to the top of that with exercise until the body does get accustomed, does handle a little bit more, and slowly that creeps up. We're going to push the exercise up again. So that's gradually creeping up and up until we are up here, till we're up at that normal amount you would handle. So everything the body at that point is doing, yes, I can handle this, yes, I can do this, let's go for it.
So let's take a look at the exercises themselves. We start with isometric exercises. These can have a quick effect of easing pain in some cases, but they're mainly about engaging the muscles without having to move into a painful range. Typically, someone with more easily aggravated symptoms or a weaker tendon would be someone starting with these. If your symptoms are only aggravated after quite strenuous activity, then you'd probably want to start with one of the harder exercises. As you'll notice, this exercise changes position, and this is again based on your level and irritability. Bent elbow, fingers and open palm position apply less stress to the tendon, so we can bring any of these in as we want to work it harder as we go along, and the same applies for when we have weight later as well. The next exercise is known as a type of eccentric exercise, which here means the muscle is working to slow down movement, but moving in the same direction as gravity or momentum rather than against it, just like it does if you catch a heavy object. In this case, the other hand will pull the affected hand up, which is relaxed, then removed, so the affected side can slowly control this movement downward. This will be easier to handle than going upward against gravity at this moment in time. Once the previous exercises have become easier, we move on to what is known as the concentric movement, which requires more power. We're isolating the movements that this muscle and tendon control. So once it is handling this type of exercise, it is demonstrating that it can handle the type of movement that it would struggle with during tennis elbow. From here, we will progress the weight and endurance to work up to match the demands of your own lifestyle.
The bottom line, yes, tennis elbow can go on its own over time, but it's so much more likely to recover faster, better, and more sustained if we use the right management and the right exercises. Thanks for watching.